So, Ms. Watson, what are the signs and symptoms of sleep apnea? How would I know if I have it or not?
Most of the time, it's picked up when you're with your primary care physician and you may be complaining of daytime sleepiness,
Okay.
coughing at night, waking up coughing or gasping, dry mouth, headache in the morning is another common one. You wake up with a headache every morning. That's usually indicative that the oxygen is low.
Right. I was going to say that sounds like something you would get, if you're not getting enough air.
You might even have something as simple or benign as thinking you have some memory loss, because there can be some memory loss involved with it as well. Or there could be some impotence. There are many symptoms, but the major ones are daytime sleepiness and snoring.
Snoring. Okay, so I guess that just begs the question then. If somebody snores, does that automatically mean they have sleep apnea?
No. I tell my patients that snoring is much like a babbling brook. So when the water is going over the stones, in some streams it'll make a lot of noise. In other streams it'll hardly make any noise. All the snoring does is indicate to us is that there's some kind of airflow going on in the back of the throat. It may be that you don't snore at all and you have very severe sleep apnea because you obstruct right away. Or it may be that you don't have sleep apnea, but you do snore a lot because there's a lot of airway. But maybe if you gain weight, it might go into sleep apnea, that snoring. So snoring itself is like a red flag.
Okay.
It's an idea that something might be wrong, but doesn't mean necessarily that there is.
This is the second time that you've mentioned weight. So how does weight play into it?
Well, when I mentioned that what sleep apnea is, that it's a combination of what the back of your throat looks like and what your weight is. So just think of it as that opening in the back of your throat very much depends upon what your weight is and how much tissue is there, and anatomically what you've inherited from mom and dad.
So we're talking about like what people commonly talk about, like your windpipe. Is that what people say? Oh, my windpipe.
Actually, no. It's the posterior pharynx, right in the back of your throat, not as far down as the trachea.
Oh, okay. Okay.
A change in weight of as little as 10% can make a difference in sleep apnea. So if you have a lot of snoring, as I mentioned, but maybe you're not having sleep apnea, but you gain 15, 20 pounds, then you could become sleep apneic. On the reverse side, if you do have mild sleep apnea and you lose weight, 25 pounds or so, then it can make the sleep apnea resolve.
You have questions? We have answers. The SitRep is your trusted source for veterans benefits information with expert analysis and interviews with leaders from the field. To find past shows, podcasts, and other content, search #TheSitRep on YouTube.